HighBridge, a division of Recorded Books, presents You Can Prevent a Stroke by Joshua Yamamoto, M.D., Facc, and Kristin Thomas, M.D. Read by Bob Souer. Animus fortitudo sapientia. Grant me the spirit to change the things that I can, the courage to endure the things that I cannot, and the wisdom to know the difference. We are all destined to age. The process is no longer as mysterious as it once was. Some things are inevitable and must be endured, but the brain lives and dies by circulation. There is much we can do to keep our circulation healthy. There is much we can do to make sure our brain is not damaged from poor circulation. There is much we can do to prevent brain damage in ourselves and our loved ones. We can prevent strokes. We can prevent vascular dementia, but only if we choose to. Introduction. I have been aggravated by many of my colleagues. The generation of physicians who preceded me were too often trained in the old school. That is, if something isn't broken, don't fix it. A great emphasis was placed on symptoms. What are your complaints? If you don't have a complaint, then all must be well. These same physicians accept that everything related to aging is inevitable. A famous bioethicist once said that there is no meaningful life after the age of 75, so why should anyone go to the doctor after that point? In my practice, I can spend an entire day and see no patient younger than 90, and they are active and healthy and enjoying life. I have 96-year-olds still wearing suits to the office. I have a 106-year-old complaining that no one will dance with her. I have an 89-year-old who wanted a stress test to make sure he could keep up with his new girlfriend, who is in fact older than he. I prescribe plenty of Viagra for a whole lot of people whom others would have written off because they are over 75. In fact, the census data now indicates that if you are 65 years old today, you can expect to live about another 20 years. I am often also asked to see the spouses of many of my patients. Unfortunately, I often see them after a decade of neglect from their physician. They are old. They are slow. Their memory may be gone. They may have lost function of much of their body or suffered some other limitation from a stroke. And these aged spouses are often younger than my patients. How does it happen that my older patients are in better health than their younger spouses? There is no magic, just a little work and a lot of attention to detail. I once tried to explain to one of my older colleagues how we practice cardiovascular medicine today. I tried to tell him that blood pressure is a number, not a disease. What matters is having good blood flow and not overworking the heart. I told him that we can measure how overworked a heart is with a simple ultrasound. I told him that the absence of chest pain does not mean someone is free from the risk of a heart attack or heart failure, but that you can look at a heart and watch someone exercise to know what their cardiac health is. I told him that if you want to know how healthy someone's arteries are, you can take 5 minutes and simply look at the arteries with an ultrasound. Explaining how the walls of arteries age, how the heart muscle ages, and how it is important to look at these things simply made this doctor's head spin. He finally threw up his hands in frustration and shouted, "You don't even care how someone feels, do you?" I couldn't help but smile inside and try to console him. I responded, "I'm a cardiologist. I don't have that luxury. Symptoms do not predict risk." I went on to say, using symptoms to look for heart and vascular disease is a lot like using an altimeter to look for a waterfall. When you are in a boat and it goes over a waterfall, you will drop rapidly. An altimeter will tell you that you are falling, but by then this information is a little late to be useful. Often, by the time you have symptoms, you have long missed an opportunity to make some simple changes that would have greatly affected your life. Now, I consider myself a medical neo-libertarian. I feel that, as a physician, it is my job to give you my best advice. What you do with it is up to you. My colleagues may often aggravate me when they are out of date, passive, patronizing, overly basic, or simply lazy, but my patients rarely burden me. There are certain basic principles that apply to all of us, but every one of us is unique. Every one of us has our particular genetic fingerprint and our particular life experiences. We are allowed to have different bodies, different preferences, and different goals. That bioethicist who wants to die quietly at home at 75 is okay by me, as long as he doesn't drag his patients down with him. Only once was I frustrated by a patient. He had chronic atrial fibrillation, an irregular heartbeat, which I will explain later. Suffice it to say, if you have atrial fibrillation, you have a high risk of stroke, unless you choose to prevent the stroke. The good news is that you can prevent strokes, but you have to believe a little of what your doctor tells you, and you have to take a pill. A lot of people hate taking pills. I get that. I only prescribe them if it's for a good and explainable reason. This fellow was adamantly convinced that he had all of the answers. His condition was asymptomatic and therefore apparently didn't really exist. I always first try to reason with my patients. If that doesn't work, I charm them or cajole them. Before this man, I never resorted to bullying. The problem was his wife was totally dependent on him. She had suffered a head injury years before and was absolutely dependent upon her husband for everything. They had no other family. Try as I could, I was not able to convince this asymptomatic man that he still needed to take a pill to prevent having a stroke. Naturally, the call from the ER eventually came. I met him in his room, his wife at his side. By this point, the stroke had left him unable to speak. He was clearly dying. There was, however, still clarity in his eyes. He seemed to have a complete awareness that he was going to die. His eyes were angry. I never was able to tell if he was angry that he was dying, angry that he had chosen wrong, or angry at seeing me. I was just angry that there was someone whose life depended on him who was now about to become a ward of the state. I was angry less at him and more at the situation. I was angry because his stroke simply didn't have to happen. It could have been prevented, but I failed to convince him of that. So, if you don't want his fate or the fate of his wife, continue listening. Please. Chapter 1. Prevent is an active verb. When I was in high school, I always liked to look in the back of the textbook to get the answers first. That way, I would know if I was on the right track in solving a problem. So, I will try to give the answers first. To keep your brain, and yourself as a whole, healthy, know the answers to the questions: 1. What is the health of my heart and circulation? 2. What can I do, or what can I do differently to keep my circulation working as safely and efficiently as possible? Fundamentally, these are the only questions I ever get asked. The questions are simple, but the answers are different for all of us. A few definitions are in order. First of all, what is a stroke? Technically speaking, we call a stroke a cerebrovascular accident. As you'll notice, doctors love to confuse things by using Latin and Greek. I suppose lawyers are just as bad. Cerebro means brain, vascular means blood vessel or refers to circulation, and accident, well, that always means something bad. A stroke is damage to the brain caused by a problem with blood flow to the brain. This is why cardiovascular doctors, also known as cardiologists, have always been responsible for preventing strokes, although they are not the doctors called when you have a stroke. The doctors called when you have a stroke are neurologists, brain specialists. They should not be the first doctor you see to prevent a stroke. Hopefully, you will never need to see one. You should see your primary care doctor or a cardiologist first. A stroke is not a heart attack. Sometime in the past 50 years, our medical vocabulary became even more confusing than it already was. The terms stroke and heart attack became interchangeable. They have a lot in common, but they are different things. A stroke is brain damage. A heart attack is heart damage. Cardiologists prevent both. Historically, we just have not been very aggressive about preventing strokes. Having a stroke means you have had brain damage, which means a neurologist, a brain specialist, will need to help you. Preventing a stroke means keeping your circulation healthy, which is not a job for a brain specialist. It's a job for a circulation specialist, that is, a cardiologist. Biologically speaking, there are several types of strokes, but most of them are caused by a clot jamming up the blood flow to the brain. Those clots tend to come from the heart or the big blood vessels leading to the brain, the carotid arteries, or they can form in the smaller blood vessels within the brain. No matter what, you don't want blood clots in your brain. That's a stroke. There are also bleeding strokes, but they are not the common ones. In fact, many bleeds in the brain start as a clot. We tend to fear bleeding, but in fact, clots are a much, much bigger problem. Clots can be prevented. That's part of how we prevent strokes. A common question is, what are the signs of a stroke? Well, the whole goal is to not have a stroke in the first place, but it is worth knowing what happens when you do clot off part of your brain. Remember, a stroke is brain damage, so whatever part of the brain you damage may not work quite right again. It may not work at all. Pick a function that your brain controls. If you clot off the part of the brain that controls that function, it won't work. Just about anything related to brain function can be lost by a stroke. For example, you may lose the ability to speak, to understand words, to see, to swallow, to move your arm or leg. You may not think right. You may be confused. Your face may droop. You may collapse. For better or worse, most strokes don't kill you. They just take something away, usually forever. If you have a stroke, you will get to know a neurologist all too well. They are the experts who can tell you just how much of your brain has been damaged and how likely you are to recover what you have lost. There are many books to help you understand how to recover from brain damage. This is not one of them. I find them all a little depressing. If you do have a stroke, sometimes dramatic things can be done to try to rescue your brain. Several new studies have been published about some of these high-tech procedures, where tubes get stuck into your head to suck out clots, or clots are melted with drugs. One of my favorite patients recently asked me about these treatments. He wanted to know what was the best way to treat a stroke. The answer was really quite simple. The best way to treat a stroke is to not have one in the first place. What is a TIA? TIA stands for transient ischemic attack. They are often referred to as mini-strokes. Transient implies that you have symptoms that come and go. They are not permanent. Ischemic means some part of your body did not get enough blood. In this case, we are talking about part of the brain not getting blood. Attack? Well, that's got to be bad. A TIA is a transient ischemic attack or mini-stroke where symptoms spontaneously recover without permanent damage. Having a TIA means that some part of your brain did not get enough blood and it didn't work. Like with a stroke, any part of the brain may be at risk. The difference between a TIA and a stroke is that a stroke leaves evidence of permanent damage. Usually, that evidence of a TIA is seen with an MRI scan of your brain. If you have symptoms of some part of your brain not working and the symptoms get better, and a brain scan shows no evidence of permanent damage, that is, a stroke, then consider yourself lucky. You have had a TIA. You have dodged a bullet. You need to think very hard about how you and your doctor are going to prevent your stroke, because it is coming. You do not need to wait for symptoms before you actively prevent a stroke. A scenario we see every day involves seemingly cryptic or mysterious terminology on a brain scan, MRI, report. Someone undergoes a brain MRI and there is evidence of an old stroke or many old strokes. The MRI is read as small vessel ischemic disease or age-related atrophy. All of this means that at some point the brain did not get enough blood flow was interrupted, or brain circulation clotted. It is entirely possible and actually quite common to find brain damage on MRI that you were never symptomatically aware of. In the past, we often felt that these abnormal scans, in which the damage shown never presented symptomatically, were much like the proverbial tree falling in a forest. If no one is there to hear the tree fall, does it make a noise? If you never have any symptoms, does it matter that the MRI says you had a stroke? If enough trees fall in the forest, there's no more forest. If enough of your brain gets damaged, you will eventually become demented. Old school. In medical school, we learned to wait for someone to have a stroke before we did any investigation. The unfortunate patient would be admitted to the hospital under the care of the neurologists. They would meticulously examine the patient to determine what parts of the brain did not work and correlate those findings with the brain scans, CT scans, and later MRI scans. We would order all sorts of tests to look at the heart and the blood vessels and monitor the heart rhythms to see if we could determine why someone had a stroke. The idea was, once we understood why your stroke happened, we just might do something to prevent the next one. New school. We know that strokes come from changes in how the heart and circulation work. We actually look for ways to prevent your first stroke, not your second, by knowing the health of your heart and arteries. Vascular dementia is the loss of brain function, especially the ability to think, due to inadequate or interrupted blood flows. There are actually several ways in which we can become demented. We tend to use terms like Alzheimer's and dementia interchangeably, but technically they are different. Dementia means that your brain doesn't work. Alzheimer's is a specific disease in which unusual proteins build up in the brain for unknown reasons. We have no good way of preventing or treating Alzheimer's, but some of what we think of as Alzheimer's is actually vascular dementia. And Mother Nature says you can have both. We may not be able to prevent Alzheimer's, but there is a lot that we can do to prevent vascular dementia. We used to say that old folks simply became senile. The inference was that their memory was gone. Their ability to think rationally was gone. They were maybe a little goofy, if not downright crazy. It finally evolved into an insult. If anyone was ever confused or forgetful, they were accused of being senile. Well, technically, senile just means old. Natural aging predictably changes circulation. As circulation changes, blood flow to the brain can become less reliable. Clots form. Blood flow can be interrupted. The heart may not pump enough blood to the brain, and the brain suffers. Then you can, in fact, become senile if you develop vascular dementia. Age is going to change circulation. It should come as no surprise that the brain suffers when circulation is inadequate. Senility is vascular dementia. If you want to avoid it, keep the circulation to your brain healthy. Perhaps the most important point is this: we do not need to simply accept growing old the way our grandparents did. We have the ability to keep the effects of time in check, at least when it comes to the heart and circulation. But we need to make the choice to be an active participant. We can prevent the changes to the heart and circulation that lead to strokes, brain damage, and vascular dementia. They do not prevent themselves. The basics of prevention were previously mentioned. Know your heart and vascular health, and to ask if you are doing everything you can to keep things working. Well, how does one do that? What do we do to prevent strokes and vascular dementia? Establish a relationship with a physician. Know the health of your heart. Know the health of your arteries. Know the regularity of your heartbeat. Know if it's time to take a medicine to prevent plaque in your arteries and whether you need a pill to prevent a blood clot. This is what we now call the Foxhall formula or protocol. It is a short list of steps everyone can take to make sure they are preventing strokes. To prevent strokes, it may not take a whole village, but it does take a good relationship with a doctor. There are things you will need to do and things you will need your doctor to do with you. Notice the list does not mention diet or exercise. Of course, fitness helps everything. A rational diet is important, more on that later. But if a magic fruit existed to keep our arteries perfectly clean and plaque-free, I'd like to think we would have found it by now. The list does include a lot of questions to be answered. Fortunately, they are all easy to answer, but you have to ask. The Foxhall Formula. Steps to take to prevent a stroke, also called the D-Heart strategy. D. Doctor. Have a doctor and ask about your heart. H. Heart. What's the health of my heart? A. Arteries. What's the health of my arteries? R. Rhythm. Is my heart beating regularly and fast enough? T. Time. Is it time for a pill? D. First, establish a relationship with a physician. D for doctor. The Internet and Dr. Google are a great way to get information, but a dedicated physician is invaluable to help you navigate your health needs over the passage of time. I ask all of my patients to see me at least once a year. Quite simply, even if you don't change in a year, sometimes we, doctors and healthcare providers, get smarter. You see, it is important to know all about your health, but knowing about your health is just the first step. The next step is working with your doctor to stay as healthy as possible. H. Know the health of your heart. H for heart. When I trained at the Johns Hopkins Hospital, we had a saying, "The definition of a healthy person is someone who hasn't been fully evaluated yet." Asking questions is easy. It's what we do with the information that matters. We call heart and vascular disease the silent killer because it does not always produce symptoms. It may be silent, but it is not invisible. We can see it, but first we have to look. If you want to know your heart's health, which you do, then look. This is done easily with an echocardiogram, echo, which is an ultrasound of the heart. It's the same machine we use to look at babies in the womb. Painless, quick, harmless, non-invasive, cheap, and covered by Medicare for a whole lot of reasons, an echo will tell us about the strength of your heart, whether it's been damaged, whether it's been overworked by high blood pressure, whether your heart valves are healthy, and how much you are at risk for the irregular heartbeats that cause so many strokes. An echocardiogram is really just part of the physical exam. There should be no guessing as to your heart's health when all you need to do is look. CT scans, also called CAT scans, are great tools for many things, but they produce still images and ultimately the heart is a moving organ. Ultrasound echo allows you to see how a heart works because you can watch it move in real time. Resist the temptation to have a scan that gives you a still picture of your heart as your only test of heart function. An echo is essential, but by itself it will tell you only how your heart works when you are sitting still. It is essential to know how your heart works when you are working. This is simple enough. Have your doctor perform some form of stress test, preferably with exercise. That is, have your doctor watch your heart as you work. No one beats a treadmill. It can always go faster. Everyone will reach a limit. If your doctor watches you walk on a treadmill and takes pictures of your heart at the same time, a stress echocardiogram, it really does answer the question, what is the health of my heart? Knowing the health of your heart is important. If your heart isn't healthy, you may not get blood to your brain, and your brain will suffer. Indeed, if your heart isn't healthy, that's just bad for everything. A. Know the health of your arteries. A for arteries. The carotid arteries are the blood vessels in your neck that bring blood to your brain. Knowing the health of your carotids is easy and important. If your carotid arteries are full of gunk, also known as plaque, the gunk and blood clots can break off and get into your brain, a stroke. If you want to know the health of your arteries, which you do, then look at them, again, with an ultrasound. A high-resolution carotid ultrasound can be an invaluable tool to know the health of your arteries and guide your plan to prevent strokes. R. Know the regularity of your heartbeat. R for rhythm. As we age, the heart naturally tends to become slower and irregular. Atrial fibrillation, or AFib, is what we call it when the heart beats in an irregular pattern. It is extremely common as we age. It is often asymptomatic, and it is a major cause of strokes that can be prevented. If your heart is beating irregularly, you may not know it, but it matters. You may benefit from some form of cardiac monitor, especially a long-term cardiac monitor, to know for sure whether or not you are having an irregular heartbeat. Also, if your heart is too slow, it may simply not be pumping enough blood to your brain. A chronically slow heart is one of the most preventable but under-recognized causes of dementia. A pacemaker may be a solution. Much more on irregular heartbeats, AFib, and pacemakers later. T. Is it time for a pill? T for time. We live in the 21st century. If we want to live the all-natural life, we must accept the fate of our ancestors who did not have modern medicine. Personal choices and lifestyle matter, but all the diet and exercise in the world will not change our genetics or make us exempt from the wear and tear of time. Once we do everything we can to lower our risks, what we are left with are the things we cannot change on our own. This is when your doctor can be helpful, determining what medicine in what dose at what time makes sense for you. Statins are a family of medicines you might know by their trade names: Crestor, rosuvastatin, Lipitor, atorvastatin, Livalo, pitavastatin, Zocor, simvastatin, Pravachol, pravastatin, Mevacor, lovastatin, Lescol, fluvastatin. They work by keeping your arteries healthy, and they prevent strokes. More on that later, too. Most of us will benefit from statin therapy eventually. Notice I did not say we need to treat cholesterol, although that helps. I said we have medicines that can keep our arteries healthy and prevent strokes and brain damage, and prevent heart attacks, too. In the past, we thought of the statins as medicines to treat cholesterol. Although they do lower cholesterol, they do much more. We also have to ask what we are doing to prevent clots from forming too easily. Many people simply take a baby aspirin, which is often very helpful. Some people can't or shouldn't take aspirin. A lot of people need a direct oral anticoagulant, DOAC, like Xarelto or Eliquis. Anticoagulants prevent clots. Too much or too little? 2 studies came out back-to-back in the fall of 2018. One said that we aren't taking enough aspirin to prevent strokes, and the other said that we didn't need to take aspirin at all. What are we to believe? If you look at the details, in the first study, patients had more plaque in their arteries or more advanced aging of their hearts and blood vessels. In the second study, almost everyone had been working with their doctors to aggressively prevent vascular aging by taking multiple medications. In that study, anyone with plaque in their arteries was excluded. The point is, treatment is not one size fits all. Some of us need very aggressive medication to prevent clotting, and some do not need much of anything. The more we prevent clotting, the more we encourage bleeding. A doctor can help sort this out. Most of us eventually need something to prevent clotting if we want to prevent strokes. Of course, the more we prevent clotting, the more we encourage bleeding. This may be one of the hardest things to accept. We tend to naturally want to avoid things that make us bleed, but we have to face the reality that most brain damage comes from clotting. Choosing to do nothing is still a choice. We must all ask, what am I doing to prevent a stroke? Chapter 2. Do you really think you are immune from time? There are at least 3 notable things that will happen to our circulation over time simply because we age: chronic vascular inflammation, loss of vascular compliance or stretchiness, and a decline in our heart's tempo. 100,000 years ago, humans died of wounds, infections, bleeding, and malnutrition. Ancient cave dwellers did not live long enough to get any of our 21st century diseases like heart attacks, strokes, lung cancer, colon cancer, and breast cancer, the current leading causes of death. In order to survive, we had to be good at healing so we would not die of our injuries. We had to be good at fighting infections. We had to be good at clotting or we bled to death. We had to store calories well. Survival of the fittest, as Darwin would say, means that we have genetically selected ourselves to heal and clot well. The body's healing mechanism is known as inflammation. We use the term immunity when we talk about our ability to fight infection. We use the term inflammation when we talk about repairing injury. They are all part of the same system. Our genetics determine how robust our inflammatory system is. We are genetically programmed to heal injuries.
Sample complete. Ready to continue?